you recall the old face. I was there when I was in JNU. So for a while I was with NISD.
Okay.
Professor Kapoor and others who used to come in, I think we also invited you. I was their coordinator for a while. So it's very nice to see you again after long.
Hello.
Yeah, lights up.
Yeah, can you hear me? Yeah, you can proceed. We are on live.
All right. We'll start. It's already 20 minutes late. Friends, good morning. Let me show my apology that we are slightly late, and these are the small challenges we have these days. The guest of the day was sharing me that she may have technical problem, but I faced this otherwise. So this is how things are happening, and I wanted to make it host, and as we have different individuals here who are associated with this forum, Democracy Dialogue, and you can see I am logged in through Democracy Dialogue. Otherwise, I would generally log in from my name. So on behalf of Democracy Dialogue and social work collectives, I welcome all the participants. There are a good number of dear participants here. And this is privileged to have a collaborative discussion on very important topic with Social Work Collective, because the last talk we had was very important, and I remember that almost more than 500 registrations were witnessed in the last discussion we had, and today also we have, more than 300 participants who have registered. So I regret for those who could not join as of now, and that is the reason we make all these talks on Facebook Live, so that it is available at public's disposal, and they can also use it whenever they want. And I also request all of you to share the link of Democracy Dialogue so others can benefit from this. This is just anecdote of the program. All of you, or I see good number of them, are participants who have been researcher, who have been a student. This is very important that before the program is started, I can see people have started giving questions to us, and that makes such programs are very important. So it is a privilege to have Dr. Archana Kaushik on the platform of Democracy Dialogue. Let me tell you, Democracy Dialogue is one of the very vibrant forum where we have been more visible online because this COVID lockdown, and we have been conducting, yes. So we have been conducting series of webinars on various issues. This has not been purely academic talk, but more on the issues which is concerned to the contemporary society, contemporary nation and society as a whole, and then as a civil society member, as a researcher, as a teacher, as a student, many of us are concerned to various issues. And today, that is one reason that we are here on this forum. Social Work Collective comes up with a very innovative idea. I appreciate the team of young researchers who have been working, and they show the interest to bring people of their concern, which is concern to everyone, not Democracy Dialogue only. So without delaying now, I'll request representative from the Social Work Collective, Mr. Tabrez, to introduce the guest. Dr. Archana Kaushik, let me quickly say that he has been very wonderful teacher, researcher, academia. And I have friends at Delhi School of Social Work, and I know Madam when I was in Delhi 13 or 15 years back. Now I'm settled at Hyderabad. So she has been very dynamic, consistently working in the area of old age or geriatric care, gerontology, as very neglected in our discipline. In sociology, we don't find people who have worked into the area of gerontology. So we are also thankfully obliged to people who have been working in this larger area of negligence in academia largely. So I welcome Dr. Archana Kaushik. Over to you, Tabrez, to introduce the guest of the day, and we can start. Can you unmute and please introduce?
Yes. Are you hearing?
Please go ahead.
Yes, good morning, all of you. This is Abdesh from Indian Institute of Dalit Studies. I think Zia sir will introduce ma'am. I'm going to introduce our forum, that Social Work Collective Young Scholar Forum has been formed by young scholars of India, specifically from IIDS. So we have decided this group to form uh, with the certain aim and objectives. The main objective is forming that we researchers face some problem like being researcher. Sometimes you need a different expertise from different disciplines. So we the young scholars have decided with the aim like strengthening the commitment toward the researcher, students, young scholar, promoting research and development, upgrade learning, academic networking, publication, like in the COVID-19, how young scholars can overcome, what can be approaches, method. So with these objectives aim, we have formed this social work collective. And for that, last time we have collaborated with Democracy Dialogue. We are also thankful to the Democracy Dialogue team and our team also. Thank you everyone for supporting and giving always opportunity to me also and our team to come with innovative idea. I would like to thank Dr. Archana ma'am. We have last time we have met in IIDS, and from that time I know her personally, and we have also in future will have a collaboration with ma'am. So with the idea was given by our team that there are people are discussing in different issues, but very few are touching on elderly. So we have decided to bring ma'am or specifically on uh, issues of old age. So welcome you ma'am, and welcome you sir. Thank you so much for giving me this opportunity. Over to you.
Quickly, before I request Dr. Archana to start, friends, Dr. Archana Kaushik is Associate Professor in the Department of Social Work, University of Delhi. She has completed her Master's in Social Work and completed her PhD in Social Work from Jamia Millia Islamia. Her area of specialization has been gerontological social work. Her doctoral work on social work, adjustment of elderly women in urban setting, was an important work, and it was reviewed as one of the very contemporary study as part of doctoral degree. She has conducted several research studies in the issues of aging, determining active aging in rural and urban locale, vulnerability dimensions of elderly women in north and northeastern states of India, distance care of the elderly, poor and vulnerable aged, elder abuse and social support for the aged. In her almost 12 years or more than 12 years of teaching career, Dr. Kaushik has taught several important papers: administration of development, welfare organization, social work with elderly, social work with families and children, counseling theory, practice at postgraduate level, and review of studies, and family and childcare at MPhil program in Delhi School of Social Work, University of Delhi. I am personally touched and proud that she is there, because she is also from my alma mater university. I am alumni of Delhi School of Economics, so that also connects me to the guest of the day. I welcome you once again, Dr. Archana Kaushik, and it is privileged that large number of audience are going to benefit from the important area of elderly population in India. Over to you once again, and please start your talk. Thank you.
Thank you so very much, Democracy Dialogue, all the students, In this lockdown period, maybe connecting with students is something that I was really missing. And thank you for giving me this opportunity. And most of the students who are now attending, have either studied elderly with me in the classrooms, or maybe right now they are studying the elderly paper. So, and this process of learning together has been the USP of our classes of elderly per se. So, rather than me speaking alone, let this process be a shared one where we would reflect, we would contemplate, and as co-learners, we would maybe discuss whatever is to be discussed. Uh, I'm sharing the PPT. Just please help me out in this, whether it is visible or not.
It's working. Yes.
It's working?
Yeah.
Okay. Uh, yes, the topic that we would be discussing today is mapping the situation of elderly population in COVID-19. Um, Elderly has been a unique social group, unlike many other social groups which are vulnerable, and we need to connect to them, we need to work with them. Elderly population group is such a unique one, and we would be discussing this today. And specifically talking about COVID-19 would be relevant only if we are able to understand the context of it. So I hope that together it would be a good learning experience for all of us. As I said, elderly is a unique social group, and what makes it unique is, interestingly, it is universal, it is natural, and inevitable part of human life cycle. We all are going to experience old age if we live long enough. So that is the peculiar aspect. That is what I said when we talk about migration issues or caste issues, class issues, gender issues. Maybe some of us are trying to be empathetic, but may not be very much, because we do not belong to that group. But old age is such a group that definitely, if not today, tomorrow, we are going to experience what it means to be an elderly. So with this, let us start this. um, Biological changes have been the characteristic feature of old age, and these biological changes are uh, marked as the negative or maybe deteriorative changes. Though there are varying degrees of these changes, but definitely all of the elderly are going to face deteriorative changes in their body functioning, say digestive system, respiratory system, and all that. But now, what is unique here is these biological changes have been there since time immemorial. In ancient times, in modern times, these biological changes are associated with old age. But what makes this elderly group unique or vulnerable is the changing socio-cultural context. Um, you must have heard, maybe many of us, maybe through our parents, or maybe um, mm, we have seen our grandparents enjoying the status quo. They are very much in command with the maybe whatever they are able to control in their life. So they enjoy that utmost respect and authority in the family. But now, if you see the elderly, they are becoming more and more marginalized. Population aging is something that is one of the factors that has led to this change in socio-cultural scenario also. Uh, Now, population aging, definitely this is an unprecedented phenomena, never has happened earlier in life. And earlier, what happened? There were very few elderly, or very few people would reach to old age. At the time of independence of India, the countries life expectancy was merely 35 years, and now it is more than 70 years. So more and more people are experiencing old age. That is considered a biggest success of human civilization, but at the same time this is also causing lot of challenges for policymakers, for planners. Uh, uh, the graph that is shown in the slide depicts how crucial this problem is going to be in future. Earlier, it is the pyramid, population pyramid, and we have seen that it is roughly triangular in nature. So the small tip denotes elderly, and gradually this has become rectangular, with the countries like Italy, Japan having more than 20% of their population as elderly, which in near future can be more than 50% even. And it is predicted that it would become upside down. The tip would be down, and the huge base from rectangular, it would again be triangular and upside down. So that is the scenario that we are going to observe. So elderly issues or maybe gerontological social work is very much relevant in this particular context. Right now, we are 8.2% of the elderly in India, and now maybe by 2050, there would be more grandparents than grandchildren. Uh, Let me specifically talk about certain health issues, and then specific to COVID-19 we would be discussing. Uh, there is reduced autonomy of activities of daily living. We all know that in old age, gradually the person's independence is curbed, and he or she becomes dependent on others in various activities of daily living, and the body becomes susceptible to many ailments like blood pressure, diabetes. Disabilities also happen because fall is very common. There is increased longevity, but especially in Indian scenario, because of poor geriatric health care, this is not at all uh, a phenomena that we can cherish. uh, that yes, we are getting older, and because there are inadequate health facilities and almost non-existent geriatric care, so that causes problems. Maybe less than 10% of the elderly people have some kind of health insurance coverage. There is scarcity of hospice services, palliative services, and NRHM document says that over 25% of hospitalized Indians fall below poverty line because of hospital expenses. Every year, 3% of our population goes below poverty line because of health expenses. Over 40% of hospitalized Indians have to borrow heavily to meet the payments of the medical services they acquire. And alongside, we have certain statistics that also show the grim picture or grim reality of healthcare. Is according to WHO, there should be one doctor per 1,000 patients minimum, and India has an average of 11,082, which shows that even healthcare functionaries are not available. Particularly in this context, now let us see how health vulnerability during COVID times has influenced the elderly. We all know that many of the comorbidities, they make the elderly people much more vulnerable. For example, any person having COPD or maybe respiratory infections, diabetes, they are much more vulnerable to the lethal effects of corona rather than their other age mates. I have been during this entire COVID pandemic situation interacting with many of the elderly people. My papa retired from Reserve Bank, and now he is staying in a group housing society where many of his age mates and his Reserve Bank colleagues retired reserving colleagues, they are there and they all are staying. So that is one of the universe that I always maybe go back to learn a lot about the elderly situation. Um, Added to this, in my society also, neighboring societies, then in Dwarka there are senior citizen associations, there are certain NGOs with whom I am associated and learning about the elderly. So particularly in this context, especially during the lockdown, and lockdown also happened all of a sudden without giving us the chance to prepare ourselves. So all of a sudden, in certain situations, particularly where the elderly, they are living all alone, they have faced lot of problems. There are a couple of cases even in my society, in other societies and areas, where because of domestic help not coming in, cook not coming in, and elderly have been habitual of or they are dependent on these services. So they are not having adequate nutrition during this period of time. They are resorting to biscuits and tea only because अब अपने लिए कौन अलग से बनाए and all that. So and that is affecting their health severely. Elderly के साथ there is another peculiar problem, and that is deficiency diseases are very common because digestive system is unable to extract vitamins and nutrients from the body because of decreasing efficiency. So many of the elderly, they have deficiency disorders, and added to this poor nutrition, if they take in, that is going to hamper a lot, and this is having a longer time. It's not only for 21 days or maybe later on 10 more days. Now it is months together that the elderly are facing a lot of problem with regard to their nutritional needs. Associated with is the medical needs. We have a number of cases where elderly, those who have appointments, surgeries lined up, cataract surgery, or maybe there are certain elderly patients requiring dialysis on regular basis because of lockdown and hospitals, they are overburdened with COVID patients. All these services took a backseat, and because of that, elderly have suffered a lot. Their activities of daily living and their daily routine, that has also affected a lot. And in this scenario, we must keep in mind that the elderly having a rigid routine that provides a sense of control. I often ask my students to maybe to recall whenever they had fall sick and lack of energy in the body. So the elderly also have this lack of energy, and sense of control also goes down. And everybody, in order to and that is the natural maybe endowment of human beings to uh, experience certain control over our own body, over our surroundings, and they are losing that control if they are not able to adhere to daily routines. So a lot of anxiety is seen among the elderly people who are not able to go to the doctors for regular checkups, um, for dialysis, for maybe surgeries that are there. So that has severely affected their maybe mental health as well as physical health. There is definitely a double victimization we have observed, the disease itself as well as the society's attitude towards them. I have seen many elderly, many people in my society, particularly males, just on joking basis, they are talking to the elderly people. Oh, so you are out. You have to. Corona maybe you may get corona and all that. So they are very much frightened, and because of these black humor, they are becoming all the more. They feel victimized all the more. And when we talk of social distancing, which is actually the physical distancing, the term social is wrongly maybe propagated. So this physical distancing is not very particularly suitable to the elderly because of their dependence on their caregivers. Many of the things they are unable to do themselves. I know one of my aunties, she fell down a few days before lockdown happened, and her right arm got fractured so badly that rod was inserted. And after that, the doctor has said ki you regularly come for physiotherapy, but lockdown happened, she couldn't go, and now she has faced lot of problem in uh, taking care of her own self. She has been independent, and now depending on her uh, maybe husband or daughter-in-law for little things, that makes her very jittery. Reports are there that elderly people, and this is across the world, they are the victims of triage. Triage is again a medical term that means prioritization. So priority is given to the younger people if there is shortage of beds, there is shortage of ventilators. So elderly are left to die, and preference is given to the younger generation. So that is, and these reports are across the world, especially Italy, France, America, and in India, because the media is also reflecting that 51% or maybe more than half of the corona deaths are among older people. That also makes the situation much more vulnerable for the elderly. um, Now coming to mental health scenario, um, definitely those elderly who are living alone, they are facing increased loneliness, because now earlier there are different cases even in my locality, otherwhere elsewhere also, that they used to have a rigid schedule for themselves. They would go for morning, evening walks, and they would maybe resort to satsang, something else. So, because of this lockdown, and even after post lockdown, because elderly they are advised not to go out, that has definitely affected the loneliness, and other mental morbidities have increased. APA and other organizations that are on working on mental health issues, they have reported that there are rising episodes of panic attacks and depression. Isolation and abandonment fear is mainly seen among the elderly who are either living alone or maybe in old age homes. Um, in fact, maybe on a lighter side, one message was circulated on Facebook that a notice from Psychiatric Association says that, dear citizens, during the quarantine time, it is considered normal to talk to walls, plants, and pots. Kindly contact us if they reply back. So these situations are very testing, and for the elderly who themselves are facing lot of problem. And I must tell you that in old age, mental health concerns increase many folds because of two reasons. One is structural, and another is functional. Our brain size when we are at the age of 30, and when we go to attain the age of 70, the brain size reduces to 10%, and it has an impact on many of our mental faculties. So definitely these are the structural reasons, and lifelong maybe experience of lot of tension, frustration, failures have also added to their functional vulnerability to mental health concerns. Now, there is fear of infection, acute fear of infection of self, and also spouse and children. One of our uncles, he was diabetic, and he was very proud of himself that yes, now he has able to control his diabetes with rigorous going out for morning walks and evening walks and controlling diet and all that. So the second day of lockdown, his son told him, "Papa, now you don't go out. Otherwise, you will bring coronavirus home and infect all of us." So listening to that from someone like his son was very bad for him. And consciously, unconsciously, the elderly, we are talking to elderly in that sense that it may lead to perceived or actual elder abuse, and maybe heightening their sense of insecurity and fear. More of infection to self, it is more prominent that they are very much worried that because of them infection may spread to their spouse and children. Also because or listening to all these news and maybe information that in private hospitals one day charge, if one fall maybe catches corona infection, is 1 lakh per day, or and maybe ventilator charges 1.5 lakhs per day. So that also heightens their sense of insecurity that if they are infected, then maybe they do not have so much of financial resources to handle this situation. Now, very much interesting part, and they're very much relevant to us, the social workers, is this fear of death. Um, Fear of death is considered to be the most natural aspect in all human beings. Just like that there is libido, life energy, there is also thanatos, or maybe death instinct. And that fear of death is considered to be the mother of or root cause of all the kinds of fears we are going to have in life. And this fear of death becomes very prominent in old age. And rather than dying or maybe extinction of one's own self, elderly people are more fearful of dying all alone. So those elderly who are living alone, and 11.3% of the elderly in India, as per 2011 census, they are living all alone. So that sense of fear of uh, dying alone is very very prominent among them. The other day, maybe 2 3 days after this lockdown happened, one of our known persons working in Reserve Bank, quite old, he passed away. And my mom said, thank God he didn't expire due to corona virus. So we laughed, but then I also realized that there is an increasing sense of stigma that these elderly people are facing, that if we die of corona, things are going to be worse. There, I have seen one particular kind of maybe behavioral trait among my grandmom, my mom, that they are very particular with regard to death rituals. So my mom often says, this is not the time that we should die, because you people would not be able to come to meet us. And because there have been cases somebody died and even children could not reach because of lockdown and all that. So that kind of fear that no, rituals won't be there for us, that is also very very peculiar to elderly people related to death. Then India is very prone to Alzheimer's and dementia, and dementia patients, they suffer a lot. In the advanced stages of dementia, even the person doesn't recall who or he or she is. Then what can we think with regard to maintaining all precautions like hand washing, using mask and all that? So that social functioning is affected in advanced stages. And so Alzheimer's and dementia patients, they are particularly vulnerable, and their caregivers also cannot afford to keep those norms of social distancing and maintaining 2 feet distance and all that, they can't maintain with regard to dementia patients. Let us very quickly talk of the economic vulnerabilities. And one more thing, we all understand that this is just because of the study purposes that we are differentiating these vulnerabilities into these domains of uh, health, economic and mental health, but these are very much collective, and life is holistic, and the implications of these vulnerabilities and constraints are faced at a collective level. Coming to economic aspect, in general, almost 93% of the elderly, they are in unorganized sector. 81% out of 81 million elderly, 51 million elderly are poor. Two-thirds of the aged, they need social assistance, whereas only 8% of the elderly are going to get some kind of social security system, and social security system is also extremely poor. There is no maybe sophisticated and effective method of finding out genuine elderly people who need social security measures. There are lots and lots of challenges we observe in disbursement of pension, and maybe under Annapurna scheme, food grain is distributed. So these are some of the issues. NSSO has shown that many of the elderly, they have to work despite failing health, and 60% are elderly men and 19% are women. Mainly they are in agriculture sector. In rural, in urban areas also, they are into unorganized sector like rickshaw pulling or maybe physically strenuous jobs they are doing. One thing we have seen that poverty accentuates old age. If you look at a poor person who seems to be 70 years, he might be 45 or 50 years old, but because of poverty, uh, old, this old age gets accentuated. Another one peculiar aspect with regard to the macro level picture, having definitely implications on all subgroups of elderly, is in most of the developed countries, workforce participation rate of older people is inversely proportional to socio-economic development because they have sound social security policies. Um, in India, this decline in labor force participation is because there are no job opportunities available for elderly where they uh, can have maybe some kind of income security, because most of them, even if re-employed, they are into unorganized sector and with meager income. Um, Old age dependency ratio is increasing, and the graph that you see in this slide, earlier in 1985, very small proportion of elderly people were there to be taken care of by the workers or maybe working population, and by 2030 it is just going to be almost the reverse of it. So these situations have created some kind of uh, a scenario where ageism or maybe stigma, discrimination against older people is increasing day by day in our society. In Cambridge Dictionary, in other Oxford dictionaries, every year words are inserted like oldies, wrinklies, that depict that yes, these terms are being used and they definitely connote elderly in a negative way. And all this situation, if you see, because earlier we talked that biological changes were there in earlier times also, but still the elderly people have enjoyed the utmost respect and authority. They have controlled the property with their name, the family's name would be perpetuated, and often whatever they say, that would become the law, almost the law. Everybody would confine to whatever the elderly people would say. So that from that kind of respect and now becoming a vulnerable group, uh, in this situation the market has played a very very important role. And because of this market, we see change in socioeconomic scenario also. um, Unconsciously, subconsciously, we are bombarded with these ideas that old age is something to be avoided. One person becomes old, he or she is vulnerable, diseased. So the natural life cycle now has become a pathological state. It was one of the very natural stage of human life cycle. But now more and more people are viewing old age as something pathological, something that we can be denied, prevented. And as a result, market is flooded with anti-aging products, creams, so that nobody wants to be old, because the young now have the power, they have the resources, they have all the important roles to play, they are the decision makers. So the young need to the young decide what is there. uh, so productivity, these are the norms of productivity, and as a result elderly are considered unproductive. These are the norms of beauty, strength, health. Then when we compare from these norms, elderly, they fail to make up to that level, and they are considered as diseased, pathological, ugly. So this is the scenario that as social work professionals, unless and until we attack that, we are not able to do much with regard to well-being of the elderly. Now coming back to economic vulnerability during corona times, we have seen most of the elderly who are in petty jobs, like or maybe physically strenuous jobs, informal sector, they have lost their work options. Migration issues are there. Elderly are also one of the subgroups of the migrants whosoever is facing problems. And then problems in meeting basic needs definitely is there. Hunger deaths are not reported, but they definitely are happening. Elderly, even in Dwarka, many of them, we have been regularly interacting, staying. They may be beggars or they may be working at a very small, earning very meager income and staying in these night shelters. Now, they are virtually on starvation. Affordability of treatment, I have discussed, that is a major problem. Spending 1.5 lakhs per day on ventilator is not everybody's pocket would allow. Even we have seen that elderly people are or maybe their needs are taken, are not the priority. They take the back seat as far as appropriation of family resources are concerned. uh, Another peculiar thing that has happened in during this corona times is elderly people, as I said, that the rigidity that the elderly people or maybe we face, yes, elderly have become rigid, or they are not resorting to modern means of cash transaction or money transaction. But for them this adaptability is very tough. Just like we have physical energy, we also have psychological energy. And in old age physical energy goes down, and likewise psychological energy also reduces. So adaptation becomes difficult. Adaptation means certain new things, certain unknown, we are stepping in certain unknown situations. And for elderly, they, because of less of psychological energy, they are facing problems in adapting to the newer situations. So what we have encountered in many situations, that elderly people are facing problems in making transactions online. They are not aware of it, they are very fearful of operating through online. And even one example from personal life, my mom had to go to chemist shop to buy certain medicines for my dad, and she took the card, and while making payment through card, um, and she in when she went hurriedly, she forgot to take her specs, and she knew this is the pin number, and she entered, maybe nahi dikha, something happened, so transaction failed. So the shopkeeper asked, she told to him, and he did it. Bought medicine, went to next shop, purchased some things else, and there also she told pin number. So, and because I have seen that many of these elderly, they become the target of financial crime also, because they are not very well versed with online transactions. And earlier in my dad and his friends, they would on one particular day hire a cab and go to reserve bank to get pension. And now uh, they are not able to go, and that, because that would also become a source of interaction with friends and other people. So they used to enjoy that one particular day of outing and getting pension. And now suddenly that stopped. 3 4 months have passed by. Earlier, because of demonetization, so all these people who are now elderly, they had the habit of maybe keeping some money at home, uh, so that whenever there is a need they can spend that. Because but after demonetization, everything, that keeping money, saving money at home, that system is gradually has eroded. So these are the problems that the elderly people are facing in making economic transactions. And cash transactions, again, we say that it can also be one of the source of corona infection. So these are some of the peculiar problems that elderly nowadays are facing. Let us concentrate now on social aspects of some of the social vulnerabilities. We know that change in family system has influenced the ascribed status of the elderly. Now they have to achieve status, they have to make sure that they prove they are still needed in the family, and which is becoming very difficult for them. Community ties are vanishing. Now even if you see an elderly person, next door neighbor being abused, we do not have even maybe um, what I say, we would most of us may not go and say ki, why are you doing this, it's a private family matter. And even if you go, uh, they say that no, don't hinder with our matters. So in earlier times, if elderly are treated uh, in a wrong manner, community would ensure that they would break all ties from those people. And so that kind of fear was there from being outcasted by the community. So that fear right now is not there, and that has resulted into increase in elder abuse. uh, and as I said, 11.3% of the elderly, they are living alone. Elder abuse, no amount of research is able to give us the true picture of or true magnitude of how many elderly are being abused. But one of the papers by Niti Aayog has said that almost a half of the elderly, they are facing abuse. Rolelessness is something that is very very peculiar to elderly, and now all of a sudden, without having any important role to play, they are considered as unproductive and spent force. Gender vulnerability is there, and very interestingly, gender vulnerability is now shifted more towards males. Males, women, elderly, they are still required in the family because they can help in kitchen, they can take care of children. But male elderly, they are not very well versed with household work, so they are considered all the more excluded from the social life. Definitely, dependence on children. It is said dependence is misery, and dependence on children make them vulnerable to abuse. Specific to Corona times, there is definitely, as I have given a few cases, that perceived and actual elder abuse has increased, domestic violence has increased, and elder abuse also. Elderly are more and more facing this isolation and alienation, particularly those living alone. And even I have seen in many families, children now they have their own gadgets and they are engaged in that. Nobody is even talking to the elderly. The situation has become so grim that that connection is becoming a disconnection. There the problem lies, and most of the young people, we can still again are adapting ourselves to internet, to social media, like the one that we are interacting right now. But elderly people, they are facing lot of problem in making use of these gadgets. I know of many elderly relatives of mine, when they first used maybe mobiles, and they were typing the message, some autocorrect happened, something, some different message went, and again they were ridiculed on that. So that refrained them from even interacting further and talking. So these are the challenges. The elderly people, we are not patient with them in terms of teaching them how to use these electronic items, gadgets. So one of the elderly people, lady in the neighborhood, she had come from one village in Uttar Pradesh to for some time to meet her son and daughter-in-law, and she did not know how to use micro this mm, sorry, I'm forgetting the term, microwave. So she was taught ki, okay, you put the food inside and then put 1 minute ka. In place of 1 minute, she had put 1 hour wala. So again, after that, she was so nervous that she never entered the kitchen till the time she remained here. So using gadgets could have made their life much easier, but maybe because somewhere we are losing patience in making them learn these, we are not considerate enough that they are not able to learn all these things. Uh, Very quickly we'll come to the implications of it. If 8%, 8.3% of Indian population right now is of elderly, if that population is considered as unproductive, spent for force, or maybe abused, uncared for, what will happen if elderly population is of 50%? 50% of human resource, even 8% of human resource, if considered unproductive, it is going to definitely have severe implications on the development of our country. So we need to find out adequate solution, and here the role of social work professionals come, and social support seemingly is the answer. um, Amicable relations are considered to be the antidote, or maybe one of the best medicine of most of the problems that elderly people are facing. I have shared many times with my students that even my PhD work has shown that elderly women who adjust well in their families, who have loving, amicable relation with their daughter-in-law, with son, with grandchildren, not only they are feeling less of, or maybe negligible loneliness, mental health challenges, but also physical morbidities have reduced a lot. They are having fewer ailments, they are less sick. Across the world, n number of studies have shown that wherever social support is there, things have become better. And social support is again one of the best answers to most of the social problems, in the sense that it reduces the dependency on government. So that social dependency on government, and that also gives a sense of being the passive receptor of care. Government would give us something and we are just the passive persons receiving it. So that sense is not very encouraging. Once social support is available, person becomes much more resilient to it. So even elderly women, irrespective of the fact that they have no money in their account, they don't own any property, they don't have any jewelry with them, but they are very confident that whenever I need, my son, my daughter-in-law, my grandchildren would take me to the hospital and would provide me best of care. If I need to go to some relative's place, they would spend money on me. So that kind of happiness, that kind of freedom elderly have enjoyed if social support is good. Again, very interesting studies also have shown that social support or maybe amicable social relations help in healing a person, overcoming any kind of disease, stress, strain in life, even PTSD. If social support is there, it is one of the maybe preventive approach towards most of the physical and mental health ailments. So social support definitely ensures taking up newer roles. As I have said earlier, that rolelessness is one of the major challenges most of the elderly nowadays are facing. And if elderly are well integrated in the family, as WHO has said, that care for the elderly is homebound. So we need to find ways and means where elderly can interact and find new roles, and they are there. It's just that for several years we have considered housewives as non-workers, and now people are again and again trying to change the scenario, or maybe outlook is changing and women are considered homemaker, and they are also considered as contributing to the family economy despite not contributing in terms of earning money. Same is the situation with elderly people. They are carrying they are playing so many important role, but that is not at all recognized. We do not even take cognizance of that. Grandmoms, grandparents, they have become very, very vital members in urban families, especially when younger uh, lady of the household, she is going to work. So taking care of children, taking care of families, and this is hardly highlighted. So one of the roles that social workers need to play is changing this scenario and bringing up a more of a positive image for the elderly. um, Social support definitely has all these benefits, including reduced social security cost. If one falls sick, very less. If one is maybe at peace, contented that yes, if medical expenses are required, my family would be taking care of me. If I fall sick, less, because I am assured that yes, I have relations, good relations within my family. So that is going to be influencing the social security cost also. And as in the initial discussion we have said that because of increased social security cost, the elderly are considered as unproductive, spent force, useless. So we can change this image if we work on social support. Very quickly, we would be discussing some of the approaches. Most of these approaches you people are aware. Vulnerability and empowerment can be taken as a continuum. There is no such situation as perfect or maybe absolute vulnerability or absolute empowerment. These are graded. So even a person who is vulnerable and you provide that person with some kind of information that would be useful for him or her, that awareness would lead to a little empowerment. Even in research, if we are doing need assessment, if we are even talking to them ki what are your needs, what are your problems, that catharsis is also going to make them feel better. So there are different strategies, and these are only a suggestive ones that I could put it here. Making elderly involved in whatever services we are offering to them. Like old age home, they should not be just an inmate there, participating in their own management system. If few of the elderly, they take charge of the kitchen, or maybe what is to be cooked, from where the material should come. So that greater involvement would get rid of lots and lots of mental health problems also. Program responses are there by CSOs, by government in this direction. Advocacy, counseling, legislations are in place. Psychotherapy is there. Intergenerational bonding is definitely one of the maybe critical areas that can lead to empowerment of elderly. So now, these are some of the approaches in continuation that definitely can have maybe that would lead to elder empowerment. These are psychosocial approaches. Counseling helplines are there. um, Community based geriatric care. We can look the entire, and it's not can, we should look the entire scenario uh, from rights based perspective, so that the elderly, they are given the rightful share in the society. And strength based social work practice has a huge scope in this area. Family enrichment programs are run across the world that have shown evidence based proof that elder care can be very very cost effective. You do not need any special money investment to take care of elderly. Just you need to work on your communication, on your relationships. um, Now, some of the initiatives that nowadays are there, and I would after that specifically come to the initiatives in response to COVID-19. There have been mobile health units by Helpage, by other organizations. Geriatric wards are there, geriatric clinics are there, some by government, some by NGOs. And there is one initiative by Helpage called Hug, Help Unite Generations. This is for the youth, college youth, maybe motivating them to be the change agents in taking care of elderly. Then school advocacy value education program is also there on developing intergenerational program or bonding. Then senior citizen associations are there in most of the major cities in India. Vriddh Sanghs was one of the experiment that happened in Madhya Pradesh, where the elderly, they are brought together and they acted as a pressure group. So any older person not getting pension can approach this Vriddh Sangh, and these Vriddh Sanghs would help particular old person to get the pension in case they want. Then self-help groups, elderly self-help groups have been one of the successful initiatives by Helpage India. I more frequently give examples of Helpage because my students for the past 15 years, for their concurrent placements, they go to Helpage. And when I did my PhD, I had since then maybe linked with elderly, with Helpage India. So that is why I have observed their programs more closely. So elderly self-help groups, there are more than 50,000 ESHGs in India, and they are providing income security to the elderly. And very very beautiful case studies they have come out with, successful stories where one elderly lady who was dependent on her family, and family was also not very well off, so they were abusing her. And when she joined this group, and after that she started earning, so that kind of confidence that she had after that, after earning herself, maybe that was the biggest weapon with her against the elder abuse that she was facing. So Alzheimer's and dementia care services are there, helpline, SOS apps are there now. Time bank ka concept is again very interesting one, not in India but abroad. But they have done in some of the countries that as young person you can take care of the elderly for few hours, few days, and that amount of time, that duration would be maybe saved in some kind, maybe some kind of a bank. And when you become old you can encash those many times. You, some volunteer would come and take care of you for those many hours that you had in your youthhood invested. So it's a very beautiful concept, and I really think that in India also some this kind of initiative should be taken up. um, so research and documentation definitely is one of the very important areas, and different areas are there in which we can do geriatric research. Now coming specifically to certain responses during corona pandemic is one, awareness is being generated. Specifically brochures are there with regard to taking care of elderly. So that and this is by Ayush Mantralaya, this is by other ministries, government, and even private actors have also generated material on awareness with regard to COVID-19 for elderly people. Then one of the very interesting programs again by HelpAge India is digital literacy program. This time because of this COVID situation, our students are doing block field work online. So what HelpAge has done, 2-3 students who are placed with HelpAge for their block through Zoom meeting, through other platforms, they are interacting with the elderly and they are teaching them how to use different digital media, maybe economic transactions kaise karna hai and all that. So this digital literacy has empowered elderly a lot, and this is one of the very successful programs HelpAge India and very much relevant in today's context. Then different CSOs are having volunteers. So any elderly couple or maybe person needing medicine cannot go out. So these volunteers can be contacted and they would bring medicines or grocery or whatever the older persons require. Helplines are there providing psychosocial counseling to information whatever the elderly need. Then food delivery services are there by philanthropic organizations, religious organizations, NGOs, where cooked meal is provided. Even in south like Amma Kitchen, Amma Canteen. So food delivery services are provided to the elderly across the country. There are certain SOS apps and services. Positive role of police is also visible during this lockdown period, where they took cake for celebrating the birthday of the older person living all alone. So and response of public utility services is also seen. Like I was giving the example of pension. Now elderly people cannot go to their offices and get the pension, or banks and get the pension. So what they have done through online transactions, they have mm, transferred the amount to their respective banks. And also writing email to the medical store, and they are getting their usual medicines, regular medicines that they are taking at their doorstep. And then another very interesting initiative is do it yourself or self-help modules or videos are come up have come up, and these are on cooking without fire, or maybe cooking nutritious food with minimal of time and things. So and all other aspects of elderly care, they are there. So those elderly living alone don't want to cook, so they can make use of this. There are citizens, like one of the initiatives happened in our society itself where I live. There, the citizens, they themselves collected around 1 lakh rupees just when the lockdown began, and every day we cooked meals and distributed to the needy, including the elderly. uh, Now, very quickly, and very important tips that I would like to share with you all, which we can, as social work professionals or as human service professionals, make use of in this time of crisis. This is called rapid model, and this is by John Hopkins University. And especially in this present scenario where we do not know how to start, how to initiate, which services are required, so this rapid model gives us a lot of cues to uh, initiate our own maybe services or whatever we intervention we want to with regard to elder care. So first is repo and reflective listening. R stands for Repo and reflective listening. Repo, we all know. Reflective listening, I'll just take one small little example to explain. For example, one of you, I'm an elderly person, and one of you calls me and wants to know what I need. And talking to you over phone, and I start shouting that now nobody is there to take care of the elderly. The situation is so bad. We have taken care of our elderly so well, and now this Kali Yuga situation is really bad, and blah blah blah. So with my all aggression that I am venting out through communicating with you, but reflective listening, how it is important here, you would understand that my need to uh, connect with somebody, my need to uh, be taken care of is being reflected to whatever I'm saying. So reflective listening is basically a skill that one needs to that one finds out what is unsaid. A person would not directly tell you that this is what I need. Nobody says directly, because one, it is not at the subconscious a conscious level that we are aware. uh, so with children, with elderly, with most of other people who are in crisis situation, reflective listening plays a very very important role. You find meaning what is being communicated, what needs are being communicated to whatever the person is saying. So this is what reflective listening is. Then A stands for assessment, and after that, based on this Maslow need hierarchy, you do the assessment. Now, in this present situation, demand is exorbitant and supply is minimal. So, and you do not know which service is required. So, making use of Maslow's need hierarchy is the best solution. First of all, target yourself to provide the physiological needs. An elderly person suffering, not maybe is starving. So providing him or her food is the first major intervention that is required. All other interventions would take a backseat. And once he or she has food, medical attention, if it is required, that is to be given. If that is taken care of, then you move to safety and belongingness needs. So this gives us maybe model or some kind of idea, some kind of path that how to go about it. P stands for prioritization. So as I said, after assessment, you prioritize things in that way. And I stands for intervention. Intervention would be any kind of linkage, any kind of referral services, maybe provision of certain schemes, uh, whatever. That would depend upon the assessment and prioritization. And last is disposition and follow up. You decide that yes, now the person is has resumed his or her social functioning, can take care of, and if required, one or two follow-ups are done. So this particular rapid model is not a long-term casework where you keep on talking to the person unless he or she attains that highest level of well-being. But this model is normally used in psychological first aid. So just like जैसे medical first aid होती है, first aid has a very minimal, very crucial or minimal time period के लिए होता है. So likewise, this is the psychological first aid that you provide to the people who are right now facing challenge in this COVID crisis. Last slide. Certain tips and bottlenecks I would like to share through my own personal experiences of interacting with the elderly people, and these may be useful for us, the social workers, while interacting, intervening with and for the elderly. See, friends and relatives, they play a very significant role in the lives of elderly. I have seen my parents were earlier staying in Saket with my younger brother, and now they moved to Noida, where right now they are living. So Noida has this society where all my dad's friends, colleagues are there. So all of a sudden, I saw a drastic change in his drastic and positive change in his health, in his mental health, in his happiness. So friends definitely are very important, and now in this COVID situation, rather than feeling disconnected, it is important that those friendly ties are revived. So elderly people, they can definitely connect, and they feel really happy after that. See, it's human psychology, and particularly with regard to older people, initially they would say, no, we can't do this, we can't handle this, we are not meant for this, we are old, we would not engage in any kind of social media interaction and all that. But once you force them a little bit and they learn how to make use of these gadgets, media, and all that, then they feel happy. A few days back, my parents had their 50th marriage anniversary, and because of this situation, none of us could physically go there. So what I did, I arranged a Google Meet for involving all my relatives who could approach. It was a long plan among our relatives that 50th marriage anniversary hogi, so we all would come and we would maybe celebrate it in a huge way, but that could not happen. So through this Google Meet, when they were able to connect with my bhua, my chachi, my chacha, and all of us, they were so delighted. So little things initially, definitely the elderly would say, no, हमसे नहीं होगा. But you maybe force a little bit, and then they would start enjoying that. I also, you students have helped me learning a lot using these social media and gadgets, and I also keep on learning this. The other day I learned how to send the voice message, and then I taught my mom, and now every few moments she would keep on sending me voice messages. So she really liked it. So connecting elderly through these media is one of the most important and easy things that we can do, and we should go for it. Again, role in involvement. See, most of the in this lockdown period, I don't think I have ever missed any of the webinars on elderly. So most of these webinars I have seen there, many of us keep on talking uh, in a very generic or prescriptive manner. टेंशन नहीं लेना चाहिए, टेंशन से दूर रहना चाहिए, as if we are purposefully involving ourselves in stress and tension. That doesn't happen. So instead, if we work on certain tips that really have worked, that is important. So role involvement, I have seen that it has worked very well with regard to the elderly in my neighborhood, parents, and other elderly whom I am interacting with. provide them any role. Like in our society also, we had now in the office we have 3 beds, oxygen cylinders, so that any person needs any emergent medical attention can be provided. So designing that entire thing, we involved the elderly who are there in our society, and they felt so happy, they felt relieved. So some kind of tension, anxiety is now waived off, that yes, now if the need be, we can get the oxygen immediately. So that role involvement, just involving them in decision making in some role, providing them, okay, you handle this, these finances, you handle this, you supervise this, that really plays a very important role, and all of a sudden they feel that yes, they are worthy enough. Hobbies, creative pursuits, I have given to 4 5 elderly people in my society color book, and they are very happy coloring it. So small little creative pursuits. Some years back, I did one research in Dwarka itself, and I asked them the elderly people what were their needs, or what were their hobbies, or what they wanted to become, or maybe any creative pursuit they wanted to pursue, and many of them said, हाँ हम गाना गाना चाहते थे, oh I was so good in maybe playing guitar, and then I forgot everything. So even creatively remembering that, uh, and trying to continue with that, gives them एक mental frame से away, जहाँ पे every time they are thinking of COVID disease, talking about these statistics going high, so from that they are moved away to a mental space where they feel secure. So that really has worked well with elderly. Adherence to some kind of daily routine is something that is very very crucial, because that daily routine gives them a sense of control. Things are in our hands. See, थोड़ा डिफिकल्ट होता है. वन ऑफ द स्टूडेंट्स हैज इवन आस्क्ड कि ये गेस्टाल्ट शिफ्ट क्या होता है. Gestalt therapy is a huge, maybe you must have uh, mm, read about this Gestalt therapy in your counseling classes. But the Gestalt shift in a layperson's perspective is looking things from a slightly different viewpoint. Like I have said, that nowadays we are looking everything from the viewpoint of youth. Youth says that youthhood is the norm, so elderly have become pathological. So now if we move this Gestalt shift, that it is okay not to be earning every time at every stage of life. It is okay to have time with us for ourselves. So these little gestalt shifts would also help us in empathizing better with the elderly. There are ample examples, elderly becoming very very fussy with regard to their health status, and we tend the youth tend to make fun of them. That is very common. One of my friends, she was telling that her father after retirement took a land very close to a hospital, and that land he bought at a very very exorbitant price, whereas at marketplace they already had a land where if they could have built the house it would have been much cheaper. But her father was very very particular, नहीं घर तो मुझे यहीं पे बनाना है. And he was right. All children left for their careers after marriage. So uncle and auntie now they are staying just next to the hospital, and whenever they need any medical attention, they can immediately seek that. So they have their own vision, and we should not be forcing our vision, our perspective on the elderly. So this slight gestalt shift would uh, make us more empathetic towards their needs. Another small instance, my mama and other elderly relatives, they keep on sending me messages. So most often they would send messages on some spiritual quote or some joke like that. But nowadays I have seen that many of these messages are coming. You should use this haldi ka pani and adrak and hot water and this one to maybe treat COVID, to prevent COVID and all that. So all of a sudden these messages I'm receiving from many of the elderly relatives, and this denotes that yes, that heightened anxiety is there at the subconscious level. So slight gestalt shift would make us more empathetic. Spiritual engagement definitely is one of, has proved to be having positive results with older persons. Remembering the positive things in life. The day when we celebrated 50th wedding anniversary of my parents, they talked when they got married and what happened, and how they used to meet each other, maybe telling excuses, lies to the relatives. So all these, and they were so positive. उनका चेहरा जो था पूरा चमक रहा था, and they were so happy कि yes, we did this, we did this. So remembering all those positive memories again and again, they put us in a mental frame where we are more peaceful, and if we are more peaceful, we are more happy, healthy, and maybe able to prevent many of the ailments. Certain bottlenecks are facilitating detachment. I have seen among elderly, especially in India, they are very, very much attached with their children. This was the socio-cultural notion also, कि children are the security for us in old age. And many elderly, they are happy if their children are happy, they are sad if their children are not having good job, if their children are facing any kind of marital issue or any issue in their life that directly influences their mental state. So that is one of the peculiar aspects, that some kind of detachment uh, they need to practice. And this is one of the areas where I am also struggling in working with the elderly to facilitate this detachment, because unless and until that detachment comes, there won't be any sustainable solution. People would sit for meditation, and one elderly would say, now I can't meditate because my son met an accident, or my son might have contracted COVID, and whole scenario, maybe the person is not able to come to that positive state of mind at all. Second, rituals and routines are so much ingrained in their psyche that any kind of shift with that that creates problem with regard to their well-being. Uh, First, I would like to talk about death preparedness a little bit. This is again one area that has huge scope with of working by human service professionals as well as social workers. In the example that I was giving of elderly, that because of this normative youth ka perspective, old age has become pathological. हाँ, likewise जब medical advancement हुआ over the years, before that in ancient and medieval times, death was one of the natural culmination of life. A person who has come into life would die. We all know this reality. But after medical advancement, death rate reduced. So nowadays death is more and more seen as a failure of medical fraternity, failure of doctor, as if we are for all times to come able to prevent death, which cannot happen. We at one point have to accept death. And Havighast has also said that this death preparedness is one of the developmental tasks of elderly. So this death preparedness is one untapped area where we really need to work and we need to come up with the modules how to talk to our elderly and prepare them for death. So these are the few points I wanted to put forth. And lastly, as we begin with this notion that old age is something either we are experiencing today or we would experience. So vulnerabilities related to old age, we all are going to experience. We Old age is not something that is separate, and we would not even maybe have any interface with it. So we are the change. Youth are particularly are the change, and uh, this is what I would like to stop here. Thank you so much.
Thank you so much, Dr. Kaushik. In fact, it was really great and elaborative presentations. I believe a lot of questions are there, and some of them have already been addressed in your presentations. Because while you were covering the area of elderly from various perspective and also from the social work perspective, some of the questions I feel it's addressed. And we also have questions in the email, those who could not continue here, they have left it. But we'll pick up a few of them, which can be more informative precisely, and keeping the time that we are already there for 2 hours. One important question is that instead of making elderly less dependent on government, should not there be any advocacy to change in the policy of the government to incorporate the philosophy of feminist ethics of care and self-determination along with active participation? I'm putting it more because I'm also interested to see what does it mean by feminist ethics of care on elderly, if you can reflect upon that.
I am not too sure whether I would be able to give the correct answer with regard to the perspective of feminist ethics of care. Um See, there are 2 3 points with regard to that. As far as empowerment is concerned, uh, it should be emancipatory. It is not that at one's cost, because if we traditionally look at certain things, uh, elderly are taken care of by the females of the household. So that was they were the primary caregivers, and with their going out and joining the job market, elder care has been jeopardized. And there are many people who definitely feel that yes, women should be at home because they need to take care of the elderly. So but when we look at from the feminist viewpoint, these aspects are uh, maybe they come in conflict with the rights of women. So having said this, my own viewpoint is with regard to the 5 principles of United Nations. United Nations has also said that when we plan any social care program for the elderly, it has to be it has to ensure independence of the elderly. It has to ensure participation. So, like we said, that government programs are more or less making the elderly people dependent, so it is not leading to independence. On the contrary, if you see a digital literacy, that is making the elderly independent. So any program that ensures independence, that ensures participation of the elderly, care, fulfillment, and dignity. So these are the 5 principles given by United Nations to ensure proper care and well-being of the elderly. Now, looking at from the feminist viewpoint, definitely with the development of feminist approach, certain traditional norms are attacked. Like I said, that care of the elderly is in the hands of the women only. So these are attacked, and these need to be taken care of, in the sense that uh, as far as possible, everybody should be responsible for his or her own well-being, because dependence is misery. Whether we today ensure that elderly are depending on some service delivery system, or maybe family caregivers, they are in fact in future lead to their vulnerability only. So some kind of systems need to be devised in that manner, and that is why I always talk of social support system, because social support system is interdependence. Dependence is wrong, but interdependence is the answer. We all are interdependent, and if we look from these viewpoints, definitely elder care can be ensured without jeopardizing anybody else's rights and willingness.
Yeah, thank you. Uh, we'll take one more question. We have question in email. People are saying, what are the initiatives by the civil society or resident welfare associations, uh, that in general, and can we also do some initiative? Yes, definitely. This area is always open, that any RWAs can, take initiative. As Dr. Kaushik has shared, that the residence she lives in, they have started cooking food for the elderly, which we don't find that you have food cooked for elderly only. Some may say that this is exclusion of the others, but I would say that it is more exclusive because somebody has taken care of this population.
Here I would like to make one point. It's not exclusion as such. Food is cooked for whosoever was the needy, and we had given food to all, including the elderly. And in fact, one of the programs of Helpage India, this mobile health units. So these are the mobile vans with all the with one doctor and medicines and one compounder, going to different resettlement colonies. And there, though it is meant only and only for the elderly, but they definitely uh, uh, address the issues of women, children, whosoever needs medical attention. Because they realized कि अगर आप खाली elderly को take care करोगे, that is not going to serve any purpose. We are going for an integrated approach where elderly are one of the members. This entire family, this entire community is for all ages, including the elderly. We are not denying anybody's right over the other.
Exactly. Thanks for additions. Yeah. एक सवाल और भी है. I'm not aware of this. This is perhaps from your area of discipline. Uh, that, would you look at old age from social constructivist point of view to say that they are vulnerable? Is it because they don't come under the category of meritocrat, deserving body within quote, as defined by Alain Bourdieu?
Definitely. See, one, because of huge majority of elderly still struggling. As I said, 93% of the elderly are in unorganized sector. Yeah, so this constructivist approach definitely is taking a very important role as far as image is concerned. In this postmodern era, we are not having one kind of image of the elderly. All the elderly people are not vulnerable. All the elderly people are not having same needs and aspirations. There are elderly who are very much empowered, who are taking or maybe who are controlling their lives of others. But vast majority of the elderly, they have become vulnerable because of this market economy. And definitely social constructivist approach plays a very important role, in the sense that what Derrida has said ना कि हर एक वर्ड का एक मीनिंग we try to uh, imbibe in our own अपने context में. I would give one small example. One of my relatives, while she was talking to the elderly person, ऐसे ही घर में थोड़ा बात में, she was offered samosa. She offered samosa to the elderly person. The person said, नहीं नहीं, I would not have. नहीं नहीं, हम तो अभी खा लेते हैं because old age में तो we would not be able to. So we are getting these cues कि old age means diseased life, old age means inactive life, old age means ये. So social constructivism definitely is, we need to change the entire paradigm, entire narrative को change करना पड़ेगा in order to ensure that elderly are viewed as an active citizen and as a contributing citizen in the society.
Absolutely. And in fact, there are some queries. I would say that, yes, any one of us can join voluntarily, either it is Help As India or any other body which is around. And if you don't find any body, civil society organization, you yourself do some initiative. That is what Ministry of Social Justice and Empowerment guidelines works for also. But I'll take one another dimensional questions here. Yes, Riju Gulati is asking, what else can be done by us as people, not as social worker, to ensure lessening of these insecurities and challenges? I think these were much more elaborated in the instances and questions, and then again given example by Dr. Kaushik that she has been in between inferring how she experienced, how some organization has done. So working on old age care doesn't mean that we work for old age, but we also prepare ourselves. We also connect ourselves with our envisioning our old age. I remember there are categories people have given that old is not only one, but you have young, old, young, old. All that categories has been more than 15 years, so I can't remember those terminologies. But see, what I feel that all these queries by participants makes that we need to connect with the old age, either in our family household life, in our neighborhood, in our institutions where we work on. And perhaps this is the reason that a good number of percentage, as presented by the speaker, that I think 8% or something are not at work. They are not finding work. In fact, finding work is one, but then are we ready to give work to the old age population is the larger question. So these are because the perspective we have built around our social life needs to be reconstructed. And then that can perhaps create area of work or avenues of work to the elderly. I have one personal, I wanted to just ask one question, Dr. Kaushik, that when we talk of old age, we also much concerned about categorizing the population we talk of. Old age is one, but the kind of SES they belong, socioeconomic background they belong. And socioeconomic doesn't mean only economic, but also the cultural background they have, the community background they have. Are we in social work perspective, or do we have some strong mechanism to address people who are from tribal background, people who are from Dalit background, people who are from minorities, or etc. Apart from the poor, a lot of poor, in another class term. So do you also address these issues in terms of social categories?
Definitely, you are right that elderly, it is not only one homogeneous age group from 60 to maybe 1900 or whatever, but there are social divisions, and they definitely add to the vulnerability dimension of elderly. Gender dimension, definitely. Then we talk of socioeconomic status. Poor elderly have different set of specific problems as compared to middle class elderly or maybe upper class elderly. One very interesting and very quickly I'll share finding of one of my studies done in Dwarka itself. Dwarka, very close to this. Dwarka is this uh, group housing, collection of group housing societies where middle class, mainly middle class professional people are staying. And very adjacent to this, there is a village. And earlier, people used to, they were the agriculturalist, and in 1991 ke around me, government of Delhi took land, and that land say they constructed houses or वो rent पे दिए, and from agriculturalist to landlords they became the people there. So when we were doing this study on active aging, we realized कि हाफ किलोमीटर का भी डिफरेंस नहीं है between this village and the द्वारका society where we collected data, but psyche में बहुत difference है. The elderly in rural India, this rural areas, they were very rigid as far as active involvement in roles was concerned. जो द्वारका के एल्डरली थे, दे वुड गो मीट देयर फ्रेंड्स, एक्सरसाइज करेंगे, एंड बट ये जो रूरल एल्डरली थे कि नहीं, बहू घूंघट निकाल के आएगी, बहू से बात नहीं करना है, बच्चों को स्कूल हम नहीं, हमने अपने बच्चे पाल लिए, वी वुड नॉट टेक केयर ऑफ योर चिल्ड्रन नाउ. So some kind of rigidity I observed when we say that applying the active aging framework. So likewise, tribal areas ke elderly, they are facing lot more different problems. One of my students, he is doing his PhD on this Kuki Naga conflict bay, and he came to know that elderly of this Kuki tribe, they have a very different kind of इमेज कि हाँ हमारा पास्ट बहुत ग्लोरीफाइड था, राइट नाउ दे आर वेरी पुअर, marginalized, but वो past बहुत glorified था before that conflict happened, and they had land, they were enjoying that, so वो उसी thought process में ही है. So the children, so they are very different, struggle कर रहे हैं with regard to their daily living, but thought process में they are still in the past. हाँ हम इतने महान थे, हम ऐसे थे. So they are suffering from a peculiar kind of mental health problems which elderly in Delhi would not face. Elderly Delhi के वो peculiar problems होंगी. So there are so many divisions. और जो गलत हम करते हैं वो ये करते हैं कि whenever we develop a policy, तो एक homogeneous community की तरह we treat elderly, whereas they are not. So वो differential vulnerabilities are there.
Exactly. More hands are there. Maybe they want to end the program. But Tabrez, you want to say something? Yeah, you're raising it.
Yes. Thank you so much, ma'am. And sorry, I forgot to introduce panelist Satyamev Jayte. He is associated with Democracy Dialogue. Apart from this, he is of Sociology and Associated Faculty Center for Exclusion and Inclusive Policy, Maulana Azhar National Urdu University. So, sorry, sir, I forget. And thank you very much, ma'am, for giving this extensive and very informative information on very important topic. Over to you, Imraj.
Yes, thank you. Yes, on behalf of our forum, the Social Work Collective's Young Scholars Forum, I take this opportunity for vote of thanks. I would like to thank our guest speaker and beloved ma'am. Thank you so much for accepting our proposal and for successfully conducting this event. It was really very insightful, wonderful, and productive session, ma'am. So thank you so much. I would also like to thank our event partner, Democracy Dialogue, Jia sir. Thank you so much for your kind support and cooperation. Without your support, we, the young scholars, would not be able to organize such successful event. That's what we think. And my special thanks to all the participants and attendees for your support and cooperation. And in last, I would also like to thanks and congratulate at the same time our team, the team of Social Work Collectives. We really worked hard for this event, and we are in young age, so it is taking time to develop such skills to organizing such events. And but really, we could successfully organize, and this is our second event, and we will further organize such events. So thank you so much everyone for attend and for your participation and cooperation. Thanks to you. So
That's
to you, yes, sir.
wonderful,
Thank you so
Himraj.
much.
Yeah,
Thank you,
wonderful.
Himraj. Thank you, Tabrez. Thank you, Jiazi.
Thank you.
Thank you very much. I
Thank you,
thoroughly
everyone.
enjoyed
Thank
this.
you.
It was great, and let's stay connected. I see good number of
Thank
young scholars there, and we loved that social work collective has large number of social workers in India. I wish that you create a lot of discourse and debate, because you are practitioners more than academics also, and we look forward for more collaborations. On the behalf of Democracy Dialogue, I thank
sure, sir.
the collectives, Tabrez, Hemraj, who have been communicating to all of us. This Democracy Dialogue is a forum we are associated voluntarily. We create conversation, not academic, but more which can intervene into our mind and thought and give some guidance. Otherwise, personally, I am also a university teacher. That is very limited, ambience we have here. Thank you, everyone. Dr. Archana Kaushik, it was nice listening you and very informative. Thank you once again.
Thank
Have
you
a
so much.
good day. Please listen. Bye-bye.